I am surrounded by such an amazing group of individuals. I am
Thank
Kimberly
you.
Benatti. Yes. Joined by Ethan Euchre.
I'm glad to be here.
Repeat that, please.
How was it said? Our
The enlightened one.
enlightened one, Jeff Wagstaff.
Oh.
And world-renowned orthopedic surgeon, Dr. Alfred Benatti.
Oh.
Oh, Lord.
This topic is very serious. I recently read several news stories about young people dying of sepsis after being misdiagnosed as having the flu. And I actually asked Ethan to get someone on the show to talk about it. And joining us right now is Tom Heymann, Executive Director of the Sepsis Alliance, an organization whose goal it is to spread awareness about this deadly, would you call it disease or deadly effect of sepsis? So thank you for being here, Tom.
Pleasure. Thanks so much, guys.
What is sepsis exactly?
Thank you.
It's not an infection.
Okay.
It's not blood poisoning. What it is your body's response to an infection. So,
right.
Think of it. If you hit your thumb with a hammer, your thumb gets bigger, white
Sure.
blood cells are rushing there to help with the inflammation. But with sepsis, the inflammation goes above and beyond. And for some reason, we don't know exactly why, the body's inflammatory response goes out of control and it starts to shut your organs down. So you end up with lots of amputations and in many cases death. And the key is to identify infections, possible infections, probable infections very early on and
Right.
start treatment with antibiotics so that the infection is stopped early in its evolution before sepsis can even begin, and if sepsis has started, to treat it very aggressively before it becomes fatal.
Why is it so often misdiagnosed?
Well, it can look like many things. You'll hear people talk about, my loved one died of complications of flu or pneumonia or urinary tract infection.
Sure.
Sepsis can start with any kind of infection. It can be, a young boy playing in the football field, a scratch all of a sudden gets infected. It can be a urinary tract infection, a kidney stone. Dental infections are very common, skin infections. So it can present in lots of different ways. And, as a culture, I think we tend to think, well, I can tough it out. This is just the flu. I'll be okay. And what happens is it progresses very, very quickly. So it's really important that, one, that the general public knows the symptoms of sepsis, and, we can learn about those at sepsis.org,
Okay.
and that our medical providers are better trained to identify sepsis, treat it, and manage it. And I think we're not thinking of sepsis as being as prevalent as it is, and there are nearly 2 million cases a year in the United States.
So I don't understand. If it's misdiagnosed so often, why is this not something routinely checked for?
That's the great question. If this is happening, why has something not been done about it?
Correct.
And in more and more cases now, hospitals are introducing a protocol and a screening tool so that anyone coming into the emergency department will be screened for sepsis because it is so common. And the challenge is people don't necessarily look all that ill
Right.
if they're septic. So having the screening tool in place in emergency departments, in home health care, with first responders can help us more rapidly identify people and get them the treatment they need.
Right.
Help is on the way, but in the meantime, we still have a long way to go to get to like where stroke and heart attack are in terms of awareness and having protocols to address it.
In other words, if we end up in the hospital and they're saying, God, we don't know the cause of what's going on, we can't track it down, next word out of your mouth should be, did you check
Sepsis?
for sepsis?
Could it be sepsis? Are they lethargic? Is there a high or low fever? Are there chills? Is the skin mottled? Any kind of change in breathing? The one sign that people have often said, it looked like flu or pneumonia until they weren't making any sense. They were disoriented. They were hard to arouse. Things like that are often the tipping point that lets you know that something is really terribly wrong.
Thomas, we're every night on the news, we hear about the horrible flu epidemic. People are dying all over the country from it. Could sepsis could it be adding to this crisis or making the flu worse, and maybe they're not diagnosing that? How does it affect the current flu epidemic?
Like skewing the stats, you mean?
Yes.
Yeah, or could people have flu and sepsis and then not realize it, or how does it affect this current flu epidemic?
It's always flu to sepsis. Sepsis is not contagious. That's another thing that, a lot of people think of. A lot of people think it only happens in the hospital. Actually, between 80 and 90% of cases actually start in the community. What happens with the flu is it can lead to infection. It doesn't always, but it can lead to infection, which then is a, fertile ground for having that septic response. Getting the flu shot, we're all hearing about this. It's not perfect, but it can help in many cases. Getting the flu shot, there's still time to do that. Washing your hands. A lot of people hate to wash their hands, particularly when it's cold, because they get dry and chapped. theft. There's no more important time. Washing your hands, disinfecting your keyboard, your phone, things like that, just to reduce the likelihood of getting an infection. Don't rub your eyes or your mouth. These little things can really make a huge difference. And if you're sick, stay away from other people. And if you're not sick, stay away from people who are sick.
Great advice.
I have to ask, though, when somebody gets sepsis, is there a certain time frame to which they will recover? And once it gets past a certain amount of hours or days, it's deadly? How does that work?
It presents in different ways, but what we do know on average that every hour from onset to treatment, there's an 8% increase in mortality. It advances very, very quickly. Just met with some parents who had this experience. The pediatrician didn't think it was that bad, and the parents had a different feeling, and they took their child to the emergency department. The girl was then medevaced to another hospital where they saved her life. Trust your gut. Don't wait, and it's really important to act on this quickly.
I need to clarify something because the way that we're describing this one looks like it's in other types of illnesses. You need to have an infection to be able to have sepsis. So if you have an infection and you mistreat that infection, then it spread through the body, through the blood, and that's the sepsis. So if you don't have an infection, you cannot have sepsis. I need to clarify that one so that people don't think it's another illness that is hidden around there.
That's right. It's not new. In fact, it's been around for thousands of years, and we're finally just recognizing that there are protocols and things that we can do about it because now we have antibiotics and we have surgery that can cut out the infection. But that's correct, doctor. It requires an infection to present itself. So no infection, no sepsis.
One thing that I found very interesting in reading the prep was that there's often complications even after you recover from sepsis. Can you talk briefly about that?
Surviving sepsis is a good thing, and we have well over 1 million people who survive each year, but about half will have either a physical impairment. We have 38 amputations per day due to sepsis, and many folks who survive have ongoing cognitive distress, anxiety, depression, almost like a post-traumatic stress syndrome. And there's also, very importantly, you're more likely to get sepsis again once you've had it, and fully 20%, 1 in 5 of people who are discharged from a hospital having been in for sepsis are back in the hospital within 30 days. It's very important once you're discharged to have transition of care back to your regular doc and let them know that you had sepsis and they should be taking special care and attention of you as a patient.
How scary. Thank you for joining us. Tom Heymann, Executive Director of the Sepsis Alliance, an organization whose goal it is to spread awareness about the deadly effects of sepsis. Thank you so much.
Thanks, Tom.
Thank you, guys.